Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Yes, ma'am. I'm Dr. Antoine, neurologist from Erode. So I'm working as a consultant here in the hospital as a neurologist.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So seizure is nothing but it is a hypersynchronization of the brain where it goes for an abnormal rhythm of the brain. So the patient will lose the consciousness sometimes and have an abnormal movements in the limbs or face or parts of the body. It will take 3 minutes time to resolve on its own if it is a basic seizure. If it
Okay,
is
and
recurrently it is coming, it is called epilepsy.
What are the different types of seizures and do they affect people differently?
Yes, ma'am. Seizures means maybe generally it is called two types grossly. One is focal seizure and generalized seizures. So focal seizures where the patient will not lose the consciousness and there will be an abnormal movements which he cannot stop it on its own. It stops by the symptom is relieving. Whereas generalized seizure, the patient will lose the consciousness and become jerky movements of all four limbs with tongue bite and incontinence of urine and fall and injury. This is what generalized and focal seizure.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Yes, cause of epilepsy is commonly if there is any tumor in the brain, any bleeding in the brain, any block in the brain, any fluid changes inside the brain is extra, any infection in the brain, or any metabolic changes inside the brain, like sodium, potassium, sugar changes inside the brain is abnormal from the normal range, it can produce seizures. And some genetic causes are there, and some metabolic causes are there, like calcium, magnesium, urea, creatinine are very abnormal. It can produce seizures.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
So, whenever patient is having some abnormal jerky movements of any parts of the body which is not controlled by himself, we have to watch it for whether it is responding to his command or it is not responding. If it is not responding, it is called involuntary movements. That involuntary movements, which is making him to lose the consciousness, that is called generalized seizure. The involuntary movement, in spite the patient is maintaining the surrounding sensorium, but he cannot stop the involuntary movement on its own. It comes for a few minutes to a few seconds and stops on its own. It's called focal seizures. It may be jerking of the lips, head shaking, limb jerking, or upper and lower limb jerking, or uproaring of eyeballs, tongue biting, or some all four limb jerking and stiffness of all four limbs, sudden fall without knowing what is the reason for the fall. So these are the some ways of presentation of the seizures.
Now, let's talk about something that many people with epilepsy face stigma. Can you tell us why epilepsy is often misunderstood?
So epilepsy, because somebody tells epilepsy, every family member will have an anxiety because once they get married, the seizure goes on with the family members every time, and they have to take a tablet for a long time. They feel, but ideally, 60 to 70% of seizures are well controlled with the drugs, and even the drugs are taken for 2 to 3 years, and then we can taper and stop it. That's why we should treat the epilepsy as early as possible. But when we go for a prolonged epilepsy withdrawal of the drugs, with we cannot take the drugs regularly, the epilepsy goes on recurrence and it forms a vicious cycle. Each cycle will produce one epilepsy on its own. That's why we have to block the epilepsy as the earliest with the drugs, and the drugs will stop for future episodes. Most of the 70% of the epilepsy are well controlled with the drugs, and each epilepsy patient differs on its own because they have a like a drug tailoring. Every patient has got its tailoring of the drug, and well controlled will be the drugs will be there. Most of the epilepsy patients are anxious because it spreads to the next generation, and they cannot marry, and they cannot drive, and they cannot go to school, and they cannot day to day activities, and they cannot do the personal well being, and their job satisfaction will not be there. The workers, means the people they work in the companies, they feel that the senior members will feel it is abnormal situation which are facing. They will avoid the duties, but not like that. We should tell them it should be well controlled with the drugs. They can live with a normal person as any other person who having a diabetic or hypertension. The patient has to take regular medication. They can live with the normal populations with person who are living with diabetic or hypertension the same way the epilepsy patient can live with the drugs regularly.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers
The
should be
main thing
aware
is
of?
adherence to the drug. So every patient who is diagnosed to be an epilepsy, they should not miss a single dose because each epilepsy drug acts for 12 hours only. So they have to take at least twice a day, or if it is a long acting drug, they have started once a day. They should be very adherent. That means half an hour to 1 hour can be the missing time from the last episode drug to the another episode of intake of the drug. So maximum try to maintain the drug dosage level morning and evening twice a day. And second thing, they should not have any sleep deprivation in the night. The night they have to sleep minimum 6 hours to 8 hours. Third one, at the present world, we have to avoid the screen time. Continuous watching a cell phone or a TV for more than 2 hours per day. So possibility of risk of that, and avoid short work jobs like swimming pool, like parachute jumping, or any sword knife action work like that. The sharp object should be avoided. Otherwise, they can live as a normal person and maintain the three things. Adhere to the drugs very sincerely, it will stop the disease. Second one, sleep at least 7 to 8 hours a day. And third one, avoid any complications like screen time. Watching a screen time in the present world is most important. These are the three major things at present.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
To prevent injuries, whenever the patient is having a seizure, somebody is watching it nearby, they should make him lie down in the position where he is standing or sitting or wherever. He should be made flat and lie down. And he should be avoided from the injurious objects by nearing surrounding him. Third one, we have to loose the one or two buttons from the neck position. You should get a good airflow. And if possible, you can lift the head and put a pillow till the shoulder to prevent the aspiration. Whatever the saliva he is having, he will swallow normally. But here, in case of seizure, when he is unconscious, he will take inside the lungs. So we have to put the head 30 degrees elevation. 30 degrees head elevation by put a small pillow, head, neck and the shoulder, and put him on the left or right, and the tongue falling on the pharynx, which will block, avoid injurious objects surrounding him. And most important, don't give any object to his hand because it is not a thing which comes when you give a key or a knife or a rod, it will kick and prick him. Because epilepsy is not a thing which comes in the hand, it occurs in the brain, which is due to hypersynchronization. It is an involuntary movement. So, mostly don't give anything in the hand to the patient to stop. Particularly, these are the myths. No, we are giving a keychain or a whatever it is rod. That is all myth. It will not stop because the brain has to stop and he will stop. During the episode, make him a lie down, avoid the injurious objects away from the person, and give a good breathing airway to him, like keep the windows open and leave the seizures to occur continuously. For it occurs generally, a regular seizure will come 2 to 3 minutes maximum. That's all, and it will stop on its own, and put him on the left lateral or right lateral position and head and elevation 30 degrees and whatever. Watch for his injurious things to happen to prevent it. And if possible, nowadays you have emergency thing is nasal spray. The midazolam comes in nasal spray, which can just push it inside the nose, 2 puffs in the nose. If it is a very small child, we have tablets which can put it in the rectum. So through the anal canal, we can keep it in that area. It will stop immediately in 3 to 5 minutes. So otherwise, when the seizure occurs more than 3 minutes, shift to the hospital as early as possible to give an IV injection or IM injection. Not oral tablet should not be given during the episode of epilepsy. You can spray it in the home. You can put a parectal in the child and shift him to the hospital as early to give an IM injection or IV injection to prevent the next seizure.
Thank you, doctor. And thank you to our listeners. Until next time, take care and stay informed.